Hi, this is Dr. Sherman Yu. I'm with TLC Surgery, and I just wanted to take a few minutes today and talk about a new and exciting procedure we're doing called the Endoscopic Sleeve Gastroplasty, or for short, we call it the ESG. So what is an ESG? So, one of the most common surgeries that we're doing these days is the sleeve gastrectomy. It's a great operation, works well for patients who fit the correct criteria, which is a BMI of over 35 with comorbidities, or someone who's morbidly obese with a BMI of over 40. What about a lot of our other patients who come in whose BMI is only 30 or higher? If your BMI is 30 or higher, you're considered obese. The problem with that is a lot of times the risks of more invasive surgeries may not outweigh the benefits for some patients. So that's kind of where the endoscopic sleeve gastroplasty kind of comes in. So what we do in that procedure, instead of cutting out part of the stomach like we do in a traditional gastric sleeve, we actually just fold it in and sew the stomach in to make it smaller. And that's all done through the mouth, no incisions on the abdomen. So, it's a pretty exciting procedure. It is new. It's been out for about the last 2 to 3 years, most commonly done really in the last year in the United States. And we're fortunately one of the practices to really be picking up on this procedure and starting to do a lot of them. So who's a candidate for a ESG? Kind of we touched on a patient whose BMI is above 30, especially if they have some medical problems tied into obesity, such as diabetes, high blood pressure, high cholesterol, heart disease, sleep apnea. All those are excellent candidates for this procedure. It's also a great procedure for patients who just want to get some weight off. Depending on the patient, we're seeing the data show about anywhere from about a 50% excess weight loss. So if you're about 70 to 80 pounds overweight, you'll probably lose about 35 to 40 pounds. And so that's the average weight loss. So what's the difference between an ESG and a traditional sleeve? So I think first it's important to know what a traditional sleeve does. So in a traditional gastric sleeve, we actually end up cutting out about 2/3 to 3/4 of the stomach. What's left behind is a little banana-shaped stomach. So when you eat food, food goes down here. One of the great things with the traditional gastric sleeve is 90% of your body's hunger hormones made there, and you're actually cutting out that part of the stomach. However, tied into cutting out part of the stomach, there are some risks. One of the most dreaded complications from the gastric sleeve is a leak. Fortunately, the risk of leaks are pretty low. However, it is present. Now with the endoscopic sleeve, remember we do this all through the mouth. There's no incisions, and what we do is we actually have a suturing device, and we sew the stomach up, and we fold the stomach in on itself instead of cutting it out. What we try to do is mimic to make the inside stomach look almost like a traditional gastric sleeve, where you have a small tubular stomach. Not only do you shrink the stomach up this way, but when you sew the stomach up, it also shrinks it up this way. So really you're reducing the volume of the stomach quite a bit. And that's one reason why we're seeing such good weight loss. And that weight loss was from a study that showed 2-year data, and they showed the 2-year data was still about 50%, which is fantastic. Just like all procedures, there's always some risks. One of the risks that really we worry about with the ESG is that it's a new procedure. I can't tell you what's going to happen in 5 years or 10 years. And so long-term outcomes aren't necessarily available yet. But as we do more of these, we'll start getting more data and we'll be able to, figure out what happens long-term. But in my mind, decreasing the size of the stomach is going to result in patients consuming less. Early on, the patients that we've seen have acted like a traditional sleeve patient. A lot of times they're not very hungry. And one of the theories is that by shrinking up the stomach, we're not allowing it to empty as quickly. And so therefore patients feel fuller longer. And so that's one thing we see. Another risk is that some of these sutures can break. The sutures are good, and they are considered permanent sutures. However, there's always a chance the sutures could tear free from where they're sewn together. Now, will that cause any problems? Probably not. What it may cause, though, is that all of a sudden you can eat more. So what we may have to do on some patients is go back and touch it up or redo this procedure, which would be, again, pretty straightforward. Benefits, of course, we see patients losing about 50% of their excess body weight. We're seeing patients, on an average, like we said, losing pretty quickly. In the first 6 months, most of the patients that we've done have lost the majority of that weight that they're going to lose. And, the recovery is great. Patients come in for surgery. It is general anesthesia. You put to sleep for the whole procedure. However, like I said, there's no cutting. So we have patients up and walking that night. They're back to work the next day or two. Sometimes patients complain of sore throat, a little bit of nausea and vomiting, or some abdominal discomfort for the first few days. And we give patients nausea medicine or some pain medicine as needed. But most patients are back to work in 2-3 days, back to the gym in 2-3 days, and just really back to the regular routine. Long-term follow-up, like for all bariatric procedures, is important. So the first 2 weeks after surgery, we'll have you come back and see us in the office. Then after that, we'll see you every 3 months for the first year. Part of the nutrition, just like for all bariatric patients, is important. And we'll have you come in and see our nutritionist. And afterwards, we'll also have you follow up with not only us, but with our nutritionist as well. So that's a little quick summary of the new and exciting procedure, the ESG. And if you have any questions, feel free to give us a call or come in and see us. We'll be happy to answer them.